Welcome everyone to our webinar on common medico-legal dilemmas faced by junior doctors in Australia, particularly in the context of the CAAKT exam. As aspiring general practitioners, it's crucial to understand these challenges to ensure patient safety, maintain professional integrity, and protect yourselves from potential legal issues. Let's start by discussing informed consent, a fundamental principle in medical practice. As junior doctors, you will frequently encounter situations where obtaining valid consent is challenging. Remember, patients must be fully informed about the risks, benefits, and alternatives to a proposed treatment before agreeing to it. One common challenge is the complexity of medical information. You will need to develop skills to explain complex medical concepts in clear, comprehensible terms. This is not just about simplifying language, but also about ensuring patients truly understand the implications of the treatment options. Another critical aspect of informed consent is assessing a patient's capacity to make decisions. This can be particularly challenging in cases involving mental health issues or cognitive impairments. You must be able to determine whether a patient can understand the information provided and make an informed decision. This skill will be tested in the CAAKT exam, particularly in the situational judgment test section. Emergency situations present another challenge. There may be times when you need to act in a patient's best interest without explicit consent, such as when a patient is unconscious. Understanding the legal and ethical frameworks around these situations is crucial. Moving on to confidentiality, it's paramount in healthcare, but can be inadvertently compromised. In hospital settings, you will often discuss patient care with multiple healthcare professionals. It's essential to ensure that sensitive information is only